Hi, I'm Jonah. I'm going to be your nursing student for today. I'm going to do a neurological assessment on you. So what that is, I'm going to ask you to do some instructions, and you're just going to have to follow to the best of your ability. Is that okay with you?
Okay.
All right. Can you give me your name and date of birth?
Michelle O, May 29th, 1993.
Okay. Do you have any allergies?
No.
Okay. So for general assessment, patient appears stated age. She is an age-appropriate female. She shows no signs of discomfort or pain. She also shows no signs of pallor or cyanosis. She is sitting upright and balanced. Okay, so for some subjective questions, are you taking any medications right now?
No medications.
Have you had any spinal or head injuries?
Nope.
How about any spinal or head surgeries?
Nope.
Okay, are you lightheaded or dizzy?
Nope.
All right, have you had any numbness or tingling throughout your body?
Nope.
All right. Can you tell me where you are? Tell me what your name is.
Michelle,
Why are you here?
get a neurological assessment.
Okay, and what year is it?
2020.
And where are you?
Reno, Nevada.
Okay, so patient is alert and oriented ×4. Her speech is coherent and her affect is appropriate to context. For pain, on a scale from 0 to 10, what pain level are you at right now?
Like a 0.
Okay. She shows no grimacing or guarding. If she was in pain, I would use old cards for further assessment. Okay, I'm going to test your cranial nerves. So for the first one, it's going to be your facial nerve, which is cranial nerve number 7. I'm going to have you smile for me, and then frown, and then can you raise your eyebrows, and then puff out your cheeks? All right, face is symmetrical, and cranial nerve 7 is intact. Cranial nerve number 2, which is the optic nerve, I'm going to have you read the first sentence right here.
Explore the value of named positions at the College of Science.
Okay, speech is clear. Cranial nerve 2 is also intact. I'm going to test your cranial nerve 3, which is your ocular motor. So just have you look at me. All right, pupils are equal and round and reactive to light. Ocular motor nerve is intact. I'm going to have you follow my pen while I perform the 6 cardinal fields of gaze. All right, so for that I tested cranial nerves 3, 4, and 6, which is the ocular motor nerve, the trochlear nerve, and the abducens nerve. They were all intact and no nystagmus was noted. I'm going to have you close your eyes and I'm going to touch you with a cotton ball. Just tell me where I touch you. I am testing your trigeminal nerve or your cranial nerve 5.
Forehead, cheek, chin, forehead, chin, cheek.
Okay. Cranial nerve 5 is intact. I'm going to test cranial nerve 8 now, which is the vestibulocochlear nerve. Just raise your hand on which side of the ear I make a noise, okay? Okay. Cranial nerve 8 is intact. Next one, I'm going to have you open your mouth and I'm going to test the cranial nerves 9 and 10, which is the vagus nerve and the glossopharyngeal nerve. So just open your mouth and say ah.
Ah.
Okay, so uvula was lifted and it remained in midline. I'm going to test your hypoglossal nerve, which is cranial nerve number 12. So I'm going to have you say light, tight, and dynamite.
Light, tight, dynamite.
And then stick your tongue out for me. Okay, so tongue is in midline and the nerve is intact. For the last one, for cranial nerve 11, which is also your spinal accessory nerve, I'm going to have you raise your shoulders. And then I'm going to resist when you rotate your neck, okay? All right. Cranial nerve is intact as well. Okay, now I'm going to test your sensations. So I'm gonna have you close your eyes and you're gonna tell me what's sharp and dull, okay? So this is gonna be sharp and that's dull, alright?
Dull. Sharp. Dull. Sharp. Sharp. Dull. Dull. Sharp. Sharp. Dull. Sharp.
Let's go on the other side.
Sharp. Sharp. Dull. 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 Sharp. Dull. Dull. Sharp. Dull. Sharp. Dull. Sharp.
Now I'm gonna perform it on your leg. So this is sharp and this is dull, okay?
Okay. Sharp. Dull. Dull. Sharp. Sharp. Dull. Sharp. 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 Dull. Dull. Sharp. Dull. Sharp.
Okay, I'm gonna do the other leg.
Sharp. Dull. Sharp. Sharp. Dull. Dull. Sharp. Dull. Sharp. Sharp. Dull. Sharp. Dull. Sharp.
Okay. Now we're gonna perform stereognosis. So I'm gonna have you close your eyes and I'm gonna put something in your palm and then you're gonna tell me what it is, okay?
Okay. Coin.
Good.
Key.
Good. And then now I'm gonna do gravesthesia. So I'm gonna write a number on your hand and let me know what it is.
3. 1.
Okay, good. Now I'm gonna do kinesthetic sensation. So I'm gonna have you lift your arms like this. And so this is up and this is down, okay? So tell me what I'm doing.
Down. Down. Up. Up. Down. Down.
Okay, I'm gonna do it on your toes now. So again, this is down and this is up. Tell me what you feel.
Down. Up. Up. Down. Up. Down.
Good. And then now I'm gonna do a strength test. So I'm gonna have you put your arms out with your palms up for me. Good. You can put it back down. No drift was noted. Okay, now we're going to check your gross motor sensation. So I'll have you put your hands on your thighs and then just turn them back and just keep doing that pretty fast. Good. And now I'm going to have you put your hands up and then touch your fingers with your thumb. Good. So gross and fine motors are intact. Okay, so now I'm going to perform a cerebellar function test. So I'm going to have you touch your nose and then touch my finger and we're just going to keep going, okay?
Okay.
Good. Okay, now I'm going to test your deep tendon reflexes.
Okay.
So I'm going to start with your patellar tendon. Good. So patellar tendons are +2 bilaterally. Now I'm going to test your bicep tendon. So have you put your hand out. Perfect. Good. I'm going to do the other side. Good. Her bicep tendons were +2 and bilateral as well. Okay, I'm going to have you close your eyes and we're going to test out your Romberg test. Good, she's balanced, so the test is negative. And then you can open your eyes now and then you could, I'm going to have you walk in a straight line from heel to toe.
Okay.
All right, good. I am all done with my assessment. Can I do anything else for you right now?
No, I'm good.
Okay, thank you.